at the moment, the demand is certainly outstripping the availability of services. We really haven't yet got the clinical services that we need to meet not just the demand, but actually the amount of ADHD that we see in the community. One has to remember that ADHD is actually a very common condition. About 2.5% of adults have ADHD, and currently in Australia, we're probably only recognizing and diagnosing and treating about 1 in 10 of them.
And I mean, demand can lead to delays, which it has. Why does it lead to increased cost?
I think in Australia, that's really a supply and demand, that when there is a surplus of demand over supply, then people are increasing their costs. I don't think that's the way that we should go. What we have to remember is that most ADHD in Australia is treated within the private sector, and that we don't currently have adequate Medicare rebates actually for people to have those diagnoses supported. So what we really need to be looking is increasing the availability of care, assessment and care within the public sector, but also making sure that the support for people needing a diagnosis or to get a diagnosis within the private sector is there through our Medicare.
So to clear something up for us here, can people self-diagnose?
Well, it's a big question. Of course, you can self-diagnose and say, yes, I've got ADHD, but that self-diagnosis isn't going to get you access to treatment. And the more serious answer is that assessing for ADHD is a very skilled task. It takes time and it takes training. And this is one of the issues that we have with the workforce at the moment, because even those professions that have traditionally been at the forefront of assessing ADHD, psychiatrists, pediatricians, psychologists, very few of them have actually had specific training in either the assessment or the support of people with ADHD.
So with a Senate inquiry now looking into the barriers to ADHD assessment, what changes are you recommending?
Well, we support the increase in the groups of professionals that can be involved, not just about GPs, but we heard yesterday from nurse practitioners who also can have the skills. But at the moment, GPs and nurse practitioners, not all of them, as I said, have that training. So we want there to be core training so that all doctors, all psychologists, all nurses are exposed to training about ADHD during their basic training, and then that training continues and develops over time so that we have a bigger group of specialists to work in the area. And so we're very happy that there are thoughts about increasing the new ways of working, but that has to come with good quality training and support.
And I mean, you know, diagnosis is one thing, then there's the ongoing care. So once the diagnosis happens, what then comes? Is it always medication? Is there always ongoing care?
No, there doesn't always need to be medication. Medication is a core part of many people with ADHD's treatment, and accessing medications currently in Australia, again, is complex and difficult. There are only certain doctors and nurses that can prescribe ADHD medications, but good ADHD care actually starts with what we call psychoeducation, educating people about their ADHD, about what ADHD means, about how ADHD impacts on their lives, and getting people to think about some of the things that they can do to manage their ADHD. So we have a growing group of professionals called ADHD coaches who specifically look at that kind of lifestyle coaching for people with ADHD to help them, I guess, develop workarounds, to develop approaches to manage their ADHD symptoms. And we also have psychological treatments, which can be very important for people with ADHD. So supporting the parents of children with ADHD to be able to parent more effectively, supporting those with ADHD with things like cognitive behavioral therapies that can actually help help them not so much manage the ADHD symptoms, but manage the associated problems, often with mood and anxiety, that come with ADHD. So it really has to be a multimodal treatment we talk about, which can often involve more than one professional.
Professor David Coghill from the Australian ADHD Professionals Association, thank you.
Thank you very much.